Good morning, sir. The first assessment that I will doing is cranial nerve. The first cranial nerve one is the olfactory, the sense of smell. Okay, ni smell this. Ano pong naamoy niya?
Mabango.
The second cranial nerve is optic. I'm also cover my left eye, so on the same side, and then I want you to look at these eyes. Don't look to my fingers, and just tell me how many fingers that you see. Can you cover your eyes?
2, 4,
The other side.
1, 2.
The next cranial nerve I'm doing is the cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, and the cranial 6, the abducens. So, ma'am, can you look this pen light? And next is I will check the accumulation. So the next is the abducens. The next cranial nerve is cranial nerve 5, the trigeminal. So, ma'am, can you open and close your mouth? Next cranial nerve 7 is the facial. Ma'am, can you open and close your eyes? And can you smile and pop up your cheeks? The next cranial nerve 8 is vestibulocochlear.
One, two,
The next cranial nerve 9 is glossopharyngeal. Say, ma'am, can you say ah? And the next is the gag of reflex. So the cranial nerve 10 is vagus. Since the patient is swallowing and talking, the swallows is okay. The cranial nerve 11 is accessory. Ma'am, can you move your head side to side? And up and down. And shrug your shoulder. Cranial nerve 12 is hypoglossal. Can you protrude your tongue, ma'am? The next assessment that I will doing is assess the ears of the patient. So the first procedure that I will doing is inspect the auricle, tragus, and lobule. The next is inspect the external auditory canal. A small amount of odorless cerumen is the only discharge normally present. Next is observe the color and consistency of the ear canal wall and inspect the character of any nodules. So the canal wall should be pink and smooth without any lesion. The next procedure is perform the whisper test.
Dog and cat. Fish, bird.
So the patient's able to correctly repeat the words as a whisper. So the next assessment that I will be doing is assess the thorax and lungs. As includes the posterior thorax and interior thorax. The techniques that I will be doing is inspection, palpation, percussion, and auscultation. The equipments that I will be using is a stethoscope. Good morning, ma'am. I'm Angelica Marcigan, your nurse for today. I will be assessing your thorax and lungs. So this assessment is very necessary because it can determine the condition of the thorax and lungs. Before we begin this assessment, make sure that you perform a hand hygiene and make sure that you give a privacy of the patient. The first assessment that I will be doing is your posterior thorax. Ma'am, can you stand up? Inspect the shape and symmetrically of posterior. Can you, ma'am, please turn around? So, while I inspect her back and front, the interior diameter, the transverse diameter, inspect the front, then the back. So, the result of the thorax is symmetric. The next is I inspect the spinal alignment for deformities. The spine is vertical aligned. The next is palpate the posterior thorax. So the findings is uniform, the temperature is no tenderness muscles. The next is palpate. You can see one hand or two hand, but I will using the two hand that are placed simultaneously at the corresponding area. Ma'am, I'm doing the assessment. Can you say 1 to 3 when I'm palpating? The next that I will be doing is percuss the thorax and percuss the diaphragmatic excursion. What you want to do is take deep breath. I will percuss your back. And hold it again. I percuss again. Next thing that I will be doing is auscultate the chest. You can use the stethoscope for the clear out that you hear. Okay.
Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale.
The next is assessing the interior thorax. So, inspect the breathing pattern. Ma'am, can you exhale and inhale?
Inhale, exhale, inhale.
The next is I will palpate your anterior chest and for respiratory extraction. I will be doing is percuss the anterior thorax. The next is to auscultate the anterior thorax. So, thank you, ma'am. So, the next assessment that I will be doing is the heart and neck vessel. So now I will assess the heart and vessel. The first, I will palpate the carotid artery. So contour of the pulse is smooth with a rapid upstroke and slower down shows it has a normally. Next is I will auscultate the carotid artery. The use of bell of the stethoscope. Inhale, exhale. Inhale, exhale. Inhale, exhale. And there are no presence of bluish. Then next, I will inspect the jugular venous pulse. Stand on the person's left side with the position of the patient supine. Now, I will inspect the jugular venous side on the person's left side and position the patient to pain to fine, remove the pillow and turn the person's head to pillow. Inspect the jugular venous pulse. Slightly away from the examined site, no pulsations of the internal jugular venous or jugular vein. I see the external vein pulsation. So, thank you, ma'am. So, the next assessment that I will be doing is the peripheral vascular. The color related to circulation. So, the patient color is depending to the client's skin tone. Next is gel pulse and palpating the ulnar pulse. Next is palpating the brachial pulse and palpating the epitocular lymph nodes located to the upper inside the arm. Next is performing the Allen test. Calculate the radial and ulnar arteries while the patient makes fist. Next, continue accommodating arteries which client release fist. Can you open, ma'am? Remove the pressure on ulnar arteries while observing the color retirum to palm. Inspect the distribution of the hair of the legs, on the legs. So, palpate the superficial inguinal lymph nodes. Palpate the femoral pulse and auscultate the femoral pulse. The use of the bell. Pause mo. The next is palpate the popliteal pulse. Palpate the dorsalis pedis pulse. Next is palpate the posterior tibial pulse. So, thank you, ma'am.